Hello, viewers. You welcome to the Franca's show. My name is Auntie Franca, the children's favorite auntie. Do you know there is a connection between childhood and adulthood? And whatever you do to a child today can affect the future positively and negatively. Do you know that? Well, this program is to create awareness to be able to optimize the child's psychological, physical, mental, and emotional well being for a better future. And today we are talking about attention deficit hyperactivity disorder. And our guest for today is Mr. Mike Olenu Tete from he's a mental health nurse anyway. Sir, you're welcome.
Thank you. Thank you for having me.
Sir, when you say attention deficit hyperactivity disorder, what is it all about?
Okay, so attention deficit hyperactivity disorder is a neurodevelopmental disorder and it's
Okay.
very common in children. When we talk about neurodevelopmental, we are talking about how the brain grows and develops. So this condition is first diagnosed in childhood and it often lasts into adulthood. And its prevalence globally is between 2 to 7%. Averagely, it's
okay.
about 5. So when we talk of ADHD, in short,
Okay, in short.
we are talking about a child who is overly active, very impulsive. They actually don't think of the consequences of their actions. They just undertake it and they don't think of the outcome of their actions. And also they find it difficult paying attention and keeping records of instructions and paying attention to details.
Oh, what are the causes of this sickness? Is it a sickness or what?
Okay, just like I said initially, I said it's a neurodevelopmental condition.
And what are the causes?
So the causes basically is unknown.
Okay.
We say it's idiopathic, it's unknown. But there are studies that have shown that genetics plays a role in here. So aside genetics also, we have low birth weight in children
Okay.
also predisposes a child to this. And there's something we call FAS, that is fetal alcohol spectrum disorder. That is a mother who takes in alcohol or probably, let's say, tobacco during the period of pregnancy. It affects the development of the child's brain that can predispose the child to this condition. We also have brain injury,
Okay.
probably through accidents. Any kind of accidents that causes brain injury can also predispose the child to such a condition.
That is during pregnancy or what?
No, not during pregnancy, when the child is born
Oh,
already.
okay.
Maybe any accident that causes any brain injury can predispose the child to that. But during pregnancy, just like I was saying, somebody who takes in alcohol or tobacco can affect the baby in the uterus. We also have exposure to environmental agents like lead during pregnancy.
Okay.
It can also affect the development of the child's brain.
Oh, so how do I what are the symptoms in I can identify that, or what are the symptoms in this?
So when we talk about the symptoms or the signs and symptoms of a child with attention deficit hyperactivity disorder, I would like to start with this. Children, commonly you can find children who are very hyperactive in their activities. They find it difficult to pay attention to details or to instructions. It's normal in kids, but somebody with ADHD, theirs kind of last for a period of time, or it goes on and it becomes very severe, and it tends to interfere in their academic performance or their school activity. It tends to affect them even in the home, and also it tends to affect their interpersonal relationship. So that is where the disorder comes in. So it's interference in their day-to-day activities. But with a normal child who is overactive, who is doesn't pay attention to details or find it difficult concentrating, such children over time get over these things. But somebody with the
Okay.
condition, it lasts or it goes through their life and it even becomes severe and it interferes
So
with their
if
daily
a child is
activities.
around, if I want to identify that these symptoms are in the child, I should look at his inability to concentrate or not paying attention, his inability to sit down, and what else?
Okay, so I'm trying to draw the difference between a child who don't have the condition and a child who has the condition.
Okay.
What you can see to draw the difference. So the main signs and symptoms itself is a child who is very impulsive.
Okay.
They don't pay attention to the outcome of their actions. They just go ahead to undertake that action. That is where you find such kids jumping around, running around, and they can even harm themselves. Also, just like I said initially, they can't take detailed instructions. When the instructions are very detailed, they tend to forget. Such children, too, you find them talking a lot. They don't wait for their turn. So, especially in class, when a question is asked and somebody is answering, they can just interrupt and just talk when they've not been invited. Some kids also fidget a lot. They fidget a lot. Others too are very overactive. Like I said
Jumping
initially,
from here to here.
running around, jumping from here to here, and it's also with such kids, it interferes in their interpersonal relationship. They find it difficult.
Is it dangerous?
Well, yes, we can say it is dangerous, especially when you look at the parts where the child is very hyperactive. He can get to the point where he can harm himself. When you look at the types of even ADHD, we have three types.
Okay, what
We
are
are-
they?
We have the predominantly inactive presentation,
Okay.
and we have the predominantly hyperactive impulsive presentation,
Okay.
and we have the combined type.
Explain it one by one.
Okay, so
Because
let me
this
take it
we
one
have
after
to
the
know.
other.
Do you also want to know? Okay. We all want to know. So please explain the types for us.
Okay, so the predominantly inactive presentation, that basically has to do with the concentration level of the child. This is where the child finds it difficult to pay attention to details and to concentrate on a particular task.
Okay.
So that is basically about the first type. And the second type is the predominantly hyperactive impulsive presentation. This is where the child talks a lot, fidgets a lot. He's always running around, overactive, and they are very impulsive in their actions. And most of these kids get to the point where they can harm themselves because of the hyperactivity and the kind of activities they involve themselves in. And the last type is the combined type. That is where you have the presentation of the first one and the second one all
in
together.
one.
Yes.
This is serious.
So when we talk of ADHD, it is not specifically a child experiencing all these signs and symptoms together.
Okay.
Yes, they can experience one part or the other or both.
Oh, okay. So what should parents do about this? Because if you see all the symptoms in your child, what should you do as a parent?
So with attention deficit hyperactivity disorder, there are simple tips the parents can do when they identify their kids with such problems. So first of all, to even identify such problems, there's a checklist of behaviors that is given to the parents to monitor the child.
So which means that the child should first be taken to the hospital. The
Ye-
child should be taken to the hospital first.
The child can first of all be taken to any mental institution for the child to be assessed. So
Okay.
medically, they can run some medical tests on the child to rule out certain conditions
Okay.
like dyslexia or autism.
Okay.
Then after that, there is a checklist of behaviors that is given to the parents to monitor the child to see if the child falls within those checklists. These checklists can also be given to the teachers for them to also do their part. Then the next part is where you interview the child. Then
Okay.
combining all these things together, then you can really diagnose the child as having ADHD. Then you can bring in the behavior modification therapy
Okay.
to be able to help the child deal with this problem. So, with the parents, for instance, one thing that is very important for the kids is their diet. It is very important that you give them food that is rich in vegetables and fruits. Very, very
Okay.
important. It helps also develop the brain very well.
Okay.
Secondly, you can also involve the child in certain physical activity, and you have to take the age of the child into consideration.
Consideration.
You can't let a 3-year-old be involved in a very strenuous exercise. It can
Okay.
just be a passive kind of exercise just to occupy the child. Also, you can limit the kind of shows they watch on television, because research has shown that children with ADHD, when they watch things that are very aggressive, they tend to act
They
it out.
practice it.
Yes,
They are
please.
the Superman type.
Yes,
I want
please.
to fly. I believe I can fly. Have you seen kids like that?
Yes,
They
please.
always want to try everything. If you leave them for a second, they will fly just like Batman or Superman. Okay, so if you're a parent and you are watching this, if you find all these symptoms in your child, first of all, take this boy or this girl to the hospital. Don't ignore that child. Don't say, oh, yeah, Karaboni, this child is so stubborn. Please find out first. What about the teachers?
Okay, so with the teachers also, it is very important that the parent will first of all let the teacher know what is wrong with the child, because many a times our teachers, because they have little or no knowledge about these conditions, they tend to see these children as being stubborn. So with education, they get to know what actually the child is presenting with. So first of all, what the teacher can do to help the child is to build a close bond, a loving relationship with the child, so that the child can have confidence or trust that particular teacher. In class, it is very important also that that particular child's desk is close to the teacher for monitoring, constant monitoring, because we earlier said it tends to affect their academics. So it is very important.
Because they will not sit down.
Yes.
Sit down, they will be standing. They will be run. They are the cause trouble people in the classrooms. They will run all over, come and pinch somebody, teach, insult somebody, pour someone's water on the floor.
Yes.
And as a teacher, if you have these type of kids in your classroom, maybe if you have 3 or 2 in the classroom, hey,
You
how
know,
do you cope?
that is why we are giving this education out,
Education,
for
yes.
them to know that it's a neurodevelopmental condition. It is not something that the child himself picked up, but it is a problem of the brain that is affecting the child's behavior. So, just like I started, you develop a close relationship with the child. You make the child sit close to you so that you can monitor his behavior and his academics. And you also make sure, because they can't pay attention to details, you make instructions very simple and very direct to them. You don't compound so many instructions and expect them to follow, because they can't even pay attention to details, so they will forget. So it is very important, it's very simple. You keep it simple and you keep it very direct.
Yes.
Those with very excessive energy, with the overactivity type, you make sure that you divert those energy into profitable activities.
In
So,
classroom, what are the profitable activities?
so you
in
realize
classroom?
maybe the child has interest in drawing.
Okay.
You make sure you let, anytime you see such behavior in the child, you divert that attention to painting.
Okay.
And one thing you should also understand is that when you are giving assignments to such children, you don't put them together, about 3 or 4 or 5 assignments together. You make sure you give it one at a time, because they find it difficult even following instructions. So if you are to give them assignments, about 4 assignments together, they will not be able to do it well. And it is very important that you also monitor the progress of the child. One thing you should also do is educate the other children on the condition so that you involve them in the management of the child. It is very important.
So you tell the class, or how do you tell
You just educate the class on the condition. You know how to go about it, not singling the child out. Yes, please. So when you educate them on the condition, they know how to go about it. So, for instance, when it comes to dealing with such a child, bringing in peers, there's assignments that is normally given, and you have to pair two people together. You can pair such a child with an intelligent kid who can monitor the progress or the performance of the child and report back to the teacher. It's very, very important.
Can it be prevented?
So when we talk about prevention, the prevention, we look at the various causes. When you look at genetics, for instance, there is nothing that you can do about it. If it runs in the family, then there's a probability that either of the children born will carry such a condition. But brain injury can be prevented. When you look at a mother who takes in a lot of alcohol or tobacco during pregnancy, education can be given to such mothers to do away with such practices so that it doesn't affect the development of the child's brain. And when we talk about exposure to environmental risks also during pregnancy, and this education can also be done so that the mother will also protect herself against these things. Premature delivery also causes.
That one you can't prevent it.
But one thing you can do is frequent antenatal care can also help you to limit this kind of problems. And this can go a long way to cut these problems down.
Okay, so are there medication for this for ADHD?
Okay, so for ADHD, the condition is actually managed. And we don't first of all jump into giving medications, although there are medications out there to help the child. So basically, normally what they start with, especially with children from the ages of 4, they start with behavior modification therapy. I mentioned earlier on, there are certain checklists that is given to diagnose the condition. And based on what is the outcome is, certain guidelines are given to the parents or even to the teachers to help modify the behavior of that child. If they realize that medication has to be added, it can be added later on. But
at what age did they start taking medication?
So the medication is actually taken based on the severity of the condition or how long the condition prolongs in the life of the child. And that is when the medication comes in. But it is basically a behavior modification therapy that is used to modify the behavior of the child to suit the environment.
Okay, so if a child has this kind of disorder, that it means that it cannot go, or can it go on its own?
That is what I said earlier on. It is managed. The condition is managed.
So you manage it forever, or you manage it for some time and it will disappear.
One thing you should understand is that ADHD is not something you can actually take away entirely. But the condition is managed so that over time, the severity of the person's behavior goes down.
Oh, okay.
Well, it cannot be taken away, but it can manage. So if your child has ADHD, it can be managed. Don't get scared. Say your last statement.
Okay.
Your last words, please.
Okay, so what I want to actually end with is that ADHD is a common condition in childhood, but mostly it is gone unnoticed, and people
Okay.
have little to no knowledge about the condition. So it is very important we know this and know that these things that the children are portraying is not something they choose to do, but there is a problem somewhere. And if we are able to identify these problems and know the ways by which we can manage it, it will help the children a lot to improve their academics, their interpersonal relationship, and their relationship even at home.
Thank you very much for coming. I believe we've all learned how to manage ADHD in our homes. We all have it in our houses. We've turned those children to be stubborn children. But today we've all got to know that it is not just stubbornness, but there is a little more to it than just what we are seeing. If you have such a child in your house, kindly rush that child to the hospital and everything will be all right. My name again is Auntie Franca. Thank you so much for watching. Auntie Franca, the children's favorite auntie. See you same time next week. Bye.